Hello again, everyone. My name is Marty Guthmiller. I am CEO of Orange City Area Health System, bringing to you today the 53rd edition of our COVID-19 community briefings. The last one, for your reference point, as I referred to the last time we talked, is last Thursday, September 3. So we have 5 days of catching up to do. I have a lot of numbers to share with you today. So we're going to start because it is the first day of the week in terms of work weeks since we had Labor Day yesterday. We do have a local scoreboard to give you, and here goes. We have 200 positives, and even 200 of the 2,313 tests conducted here at Orange City Area Health System. 16 of those tests are currently pending. The 200 positives represents 26 additional positives since August 31. We're currently at 8.6% positive rate. That is up a little bit from 7.95. Interestingly enough, and I'll get to this in a little bit when I respond to a couple questions that were posed on this forum, that we have discovered a few positives on asymptomatic patients that were being screened for surgery. So we have come across a couple of those as well. And so I'll talk a little bit more about that in just a little bit. Stepping from the local community to Sioux County, we do have 1,001. We've hit the 4-digit mark now, 1,001 positives of the 5,968 tested. I'm going to talk a little bit more about the historic positivity rate in Sioux County in a moment, but the current rate is 16.8% tested. Previously, we were at 16.3, and the time before that, 16.1. 83%, and this is a number that hasn't changed for a while, 83% of those positives are 60 and under, age 60 and under. 58% of those positives are age 40 and under. So the point in that is that our positives are occurring largely in the population best suited to handle the virus. Again, more on that coming, and in fact, more of why we talk about positivity rates. So we'll talk about that in just a second. The percent positive 14-day average number that I've been reviewing over the last few times is not a good number for Sioux County. But we are at 21.1% 14-day positive average. That's number 2 in the state in terms of being the highest. Johnson County remains at number 1 at 22.2%. One positive thing about the 14-day average rate is that there are 25 counties in the state of Iowa at 10% or more, and that number that I've been tracking over the last couple weeks was at 32 the next time. So again, there are 7, or the last time we talked. So there are 7 fewer community or counties that have a I'm sorry, going a little too fast. The infection rate, positivity rate of 10% or more. So 7 fewer counties in that category, which is good. Region 3, not positive numbers in Region 3. We have 52 currently hospitalized in the 20-county region in Northwest Iowa. That number previously was 44. We have 12 patients in the ICU. That number was previously 7. We've admitted 3 patients in the last 24 hours. We do have 4 COVID-19 patients on ventilators in Region 3. In terms of the state, we have 68,940 positives. Of the 659,545 tested, that is a 10.5 positive rate. Our previous number was 10.3. It's interesting that 16% of those positives are 61 years old and older. So 84% would be under 60 and under. And as I mentioned, in Sioux County, that number is 83%. So again, the number in the total state is really being mirrored by what's happening in Sioux County as well. Hospitalizations in the state of Iowa, and the most recent number I have, it's set on the site, coronavirus.iowa.gov, that this was September 5th. So these numbers are as September 5. There are 295 hospitalizations in Iowa. Now, a point of clarification, as we looked and researched into these numbers before, when we talk about Sioux County hospitalizations, and that number today is 5, my previous thought was erroneous. It was not correct. I had always assumed that that were the number of hospitalizations in Sioux County hospitals. That turns out not to be correct. It is actually the number of Sioux County residents that are hospitalized anywhere in Sioux County hospitals and beyond. So that could be Sioux City, that could be Sioux Falls. In Sioux County's case, that could be Sheldon, it could be Lamar's. But in any case, as of today, or as of September 5th in this case, we've had 5 Sioux County, we have 5 Sioux County residents who are currently hospitalized. O'Brien County's 5, and again, that doesn't mean they're hospitalized in O'Brien County, it means there's 5 O'Brien County residents hospitalized. Lyon County, 0, Plymouth County, 6, Beebe, 0, Clay, 0, Dickinson, 1, Woodbury, a big jump, actually 22. And that is up from 13. Again, that's not affected necessarily by Woodbury County hospitalizations. It's affected by the patient of origin. So that means that there are a number of Woodbury County residents that are now hospitalized as well. And that's reflected in that statistic. Polk County is at 43. Positive development there in terms of reduction. They were at 57. So that's they're still the highest in the state, but that is 43 versus 57. The last of the statistics that I will review, as I've historically done, are the number of deaths in the state. That number has climbed by 40 since September 3rd at 1,174. A little bit of the demographic of those patients, and it has not changed, is 89% of those deaths are age 61 and higher. 2% are age 18 to 40, and 0% 0 to 17. So when you look at 0 to 40, the death percentage in Iowa is 2%. Another stat that is somewhat encouraging is that the death rate is actually declining since September 1. And that's after a rise in the death rate since July 1. So it has been climbing since July 1, since September 1, that rate is going down. Now that's only been 8 days, but we'll take it, and that is encouraging. I want to shift now to a couple questions that were asked that really reflects back on these statistics and may be inherent in some of the things I've been talking about over several months now. And that's a question generally that goes like this. Generally speaking, are you testing symptomatic patients? And the gist behind that question is that basically, is the positivity rate going up because you're testing symptomatic patients? The answer to the question is yes, we are typically testing symptomatic patients generally. One could argue the better screened that patients are, the more educated that patients become as to symptoms, the higher the positive percentage. Naturally, people that believe they have COVID and know what those symptoms are present themselves for tests. The likelihood in today's environment is that they do have it. So one could argue that. There may be some truth to that, but we as healthcare providers are not subscribing to that theory. The percentage is what it is, and we're dealing with that accordingly. Another question was the purpose. What is the purpose of following the positivity rate? Why not focus more or solely on the acuity level? Again, a great question, and it's always good to go back and say, why are we following this? Why does it matter? What's the importance of it? And you can go back to the narrative originally last March where we wanted to flatten the curve, where we use the positivity rate as an indicator for future surges in the health system. The need for PPE, the need for hospital beds, the need for ventilators, all those kinds of things. And that typically the patient's needs lag behind that first date of positivity knowledge. In other words, it takes some time for the disease to progress. Most of the time, that's true. That you need to wait a week, 2 weeks to really see how the disease progresses and the resources that you will need, or the health system across the country will need to provide. It's really been used as an indicator for that. Now, one of the things that I went back and looked at, because we've been challenged a little bit on the fact that we've been not given enough adherence to the positivity rate. And so I went back to the 25th edition, which is on June 3rd. That positivity rate in Sioux County was 19.2%. I then moved about a month ahead, as close to the 3rd as I can, because I want to be consistent here. The 35th edition, which was July 6th, had 15.7. So at 19.2, 15.7. The 44th edition, which was on August 3rd, had 14.6. The 52nd edition, which was on September 3rd, had 16.3. So when you go back over the last 4 months, you got 19.2, 15.7, 14.6, and 16.3. Taking those numbers over that period of time, we've had relatively consistent acuity level as measured by hospitalizations. And when I say we, I'm talking about Orange City area health system, and I'm talking about Sioux County specifically, because that's really what matters the most in terms of our population. We have not seen the surge. We continue to not see the surge, and we pray that that continues. And so when I talk about we haven't seen the downstream effects yet of a positive rate being number 2 in the state relative to the 14-day average, or the current rate that we are at 16.8%. Yes, that's concerning, but it is not alarming given our history of observing and dealing with this at the ground level here. And again, we pray that that continues, that the high positivity rate does not manifest itself in a higher acuity level. To date, that has proven not to be the case. And while we're not assuming that it will continue to be the case, we have good reason based on the data to believe and trust that our current acuity will stay where it is or even be lower. So I hope that answers a couple of those questions and gives a little bit more insight into why we follow what we follow, some of the thought behind what we track and why. And so, again, thanks. If we're able to answer any questions, we will moving ahead in the future. So we appreciate those thoughts and questions. And hopefully we can clear up a few things moving forward. So that's it for today. My plan for the week is probably to do another briefing on Friday morning at this point, since today's Tuesday. And so if you're of interest, tune in again this coming Friday. And we thank you for joining us today. And as we have signed off before, stay strong, stay vigilant, continue wearing masks, continue your hygiene, those types of practices, and stay strong. Well, I said that, stay healthy. So stay strong, stay vigilant, and stay healthy. Thank you again for joining us today.